Namaskar, good evening. Speaking from Fortis Healthcare. Today's discussion is a Facebook Live session with some of our senior endocrinologists of Fortis from different units spread across our network of hospitals. And the topic is on diabetes, मधुमेह जो हिंदी में बोलते हैं. So उसके ऊपर ये करेंगे, बात करेंगे. And so I would like to welcome the honorable panelists here. Dr. Anupam Biswas, he's the senior endocrinologist and from Fortis Hospital, Noida, which is in NCR in UP. Then we have Dr. Srinivas Munigotti, who's from Fortis Banakatta Road in Bengaluru. We have Dr. Vijay Gudwar from a new hospital, Fortis Jalandhar in Punjab. And then we have Dr. Ila Reddy Chintala from our sister chain, Gleneagles Hospitals, which is the LV Nagar Hospital in Hyderabad. And later on, we'll be joined by a gynecologist. And people will be worried why what is gynecologist doing in diabetes. There's a lot of link there, so it will be interesting when she comes on board. She's just handling a serious patient. She's coming on. Dr. Nikita, she is the director of Obs and Gynec from Fortis Hospital at Gurugram, the Fortis Memorial Research Institute. So welcome everyone, and thank you all the panelists, and looking forward for a great session with the esteemed group. So I'll start off with Dr. Anupam Biswas. So Dr. Biswas, in a simple manner, could you just explain, because a lot of people will not be medicos, will be listening to this, hearing this, seeing this, what exactly is diabetes? How does it develop? And are there different types of diabetes? So for a layman, it will be a nice thing to, at least when you start this conversation, what is exactly diabetes? How does it develop? And what are the different types of diabetes? Over to you, Dr. Vishwas.
Thank you, sir, for having me in this panel. So diabetes, as we all know, it is a group of metabolic disorders which can lead to increased blood glucose. So if you look at the ADA criteria for defining diabetes, if someone's fasting plasma glucose is 126 or more than that, if the 2 hours after food or postprandial plasma glucose is more than 200, if the HbA1c is 6.5 or more than 6.5, and if the random blood glucose is more than 200 and the patients have symptoms of hyperglycemia, the osmotic symptoms like polyuria, polydipsia, polyphagia, then it is said to be diabetes mellitus. Now coming to the types of diabetes and why does it develop. So in the definition of diabetes itself, it says that group of metabolic disorders which can lead to increased blood glucose because of defects in secretion of insulin और डिफेक्ट्स इन दी इंसुलिन एक्शन. तो जैसा कि हम जानते हैं डायबिटीज के कई प्रकार होते हैं. There can be various types of diabetes, but if you look at the guidelines, it classifies into mainly 4 types. So the first type is type 1 diabetes, which occurs because of destruction of the beta cells of pancreas which make insulin. That is type 1 diabetes, where you have insulin deficiency and the patient may require long-term or lifelong insulin treatment. Then you have type 2 diabetes. Type 2 diabetes is a multifactorial disease. इस पे बहुत सारे reasons हो सकते हैं. This includes genetic defects, it includes ethnicity, it includes sedentary lifestyle, it includes poor diet, it includes obesity and overweight. So these are all the causes which predisposes to type 2 diabetes. Then you have a third type which is known as gestational diabetes, which is commonly seen during at the onset or first diagnosed during pregnancy. So type 1, type 2 and gestational diabetes. Lastly, you have other specific type of diabetes. What are these other specific type of diabetes? It includes monogenic diabetes, where there could be genetics of certain genes which can lead to diabetes. Probably most common causes what we see is MODY, which is maturity onset diabetes in young, and even neonatal diabetes. Then you have drug related or chemical related diabetes, where commonly used drugs, as we have seen even during COVID times, glucocorticoids, steroids can lead to increase in blood glucose level. Then you have something known as pancreatic diabetes, where chronic pancreatitis or even cystic fibrosis can lead to diabetes. And another very important cause, which includes certain endocrinopathies like Cushing's disease, acromegaly, these can also lead to diabetes. So, broadly, these are the type of diabetes which are commonly seen in our day to day life. The most common is type 2 diabetes among all of these.
Thank
Thank you.
you. Now I'll go to the Indian Silicon Valley, Bangalore. Dr. Srinivas, over to you now. So, Dr. Bishwas mentioned about some organs getting affected and all that. So, taking it from him, is that how early can diabetes begin harming the nerves, eyes, or kidneys, even before a person knows they have it? Because in the public domain, a lot of people are not aware of it, but it's a silent killer, if I can call it. Start affecting organs. So, what is the message that you want to give? That how early can diabetes begin harming the the nerves, the eyes, the kidneys, before a person knows it?
That's thank you for inviting me to the panel discussion, Dr. Panigrahi. This is a very interesting and a very important question. In fact, in the end, diabetes management hinges on the idea that we prevent these complications from developing. So, to answer your question specifically, for the benefit of audience, diabetic neuropathy, roughly 10 to 15, 20% of patients at the onset will have some symptoms related to neuropathy, but many a times once sugars improve, they quickly settle down. But over the lifetime, 25% of diabetic patients will have about diabetic neuropathy symptoms in about 5 years, 40% over 10 years, and nearly half of diabetic patients develop neuropathy over a period of their lifetime of having disease. And the importance lies in the idea that this neuropathy will affect their ability to perceive sensations in the leg. And so they are prone for foot ulcers. Unfortunately, they can't protect their own skin and foot, and so they're prone for foot ulcers. And that unfortunately can lead to complications that may even lead to amputation of the foot, which severely affects the quality of life and health of the patient. So many a times this neuropathy happens and progresses over the years, and patients end up having
Sorry, some glitch. We are having some technical issues. Sorry for it. I will just move over to Dr. Vijay while we get the connections through. So, Dr. Vijay, after diagnosis, what are the key things a person must do in the first few months to remain healthy and prevent complications?
Thank you, sir. First of all, having me in this panel. And first few months are actually very, very important. As they say, well begun is the half done. The same holds true in case of diabetes management as well. And to prevent the complications, patients should be made aware of what complications do diabetes have, and he should be made aware that aim of diabetes management is not just a mathematical number of fasting and the postprandial or HbA1c values, but our ultimate goal is to prevent or halt the progression of diabetes related complications. This is very, very important, as most of our patients, when they are diagnosed with diabetes, they are in the state of denial that they can't have diabetes, or it is just because of first just few days of binge eating or parties that they have got their sugar levels high, or they are bombarded with misinformation slash misinformation from the social media and the family and the friends. So what ultimately happens that they delay the treatment. And what evidence we have from the DCCT follow-up and the UKPDS trial, that we should counsel our patients that it is the good glycemic control in the early years of the diabetes management which helps in the prevention of the long-term complications. We have data of around more than 20 years of the follow-up data of the DCCT and the UKPDS trial. So patients should be counseled that it is the good glycemic control in the early years which matters the most. And what otherwise what happens in the practicality that patient comes to us for the diabetes management when he lands up with the complications, when he started having burning sensation, paresthesias, then he reaches to us. So at first one or two initial OPD visits, it is very, very important to impart this education to the patient. So, as they say, first and the foremost is definitely the lifestyle modification, to for of which diet and the regular exercise are the most important part. In the diet, patient should be counseled to cut down the carbs, restrict the food items with the heavy glycemic index, to restrict his saturated fat intake, and at least 150 minutes of moderate intensity exercise per week with at least 2 days of resistance exercise per week is the first and the foremost. Having said that, what I tell my patients that you may follow with whatever doctor you wish to follow, but please keep checking your glucose level at regular intervals, like fasting or BPG monthly, and HbA1c at least 3 monthly, because those glucose levels they make a visual impact, and then patient follows his doctors diligently.
Thank you, Dr. Vijay. Dr. Srinivas has come back. There was a technical glitch. So over to you, Dr. Srinivas.
Apologies. So yeah, sorry. Thank you for carrying forward. I'm really sorry there was a disruption. So what I was about to say is nearly 50% develop these neuropathy-related complications in their lifetime. So the important thing is to stress to the patient is they should be aware, and when they are attending the OPD very early on, we screen the patient and counsel them, one obviously about the good sugar control, but also if they do have neuropathy symptoms or neuropathy signs wherein they have problem with a nerve sensation, then they should ideally be counseled about good footwear, good foot care as well. They say you have to look after your foot like how you look after your face, to minimize any undetected ulcers leading up to later on complications. So the idea is nearly about 5 years from diagnosis, 1/4 will be prone. Good screening, education, and counseling the patient about awareness of this particular problem, number one. Number two, about nephropathy. Again, nearly 40% develop nephropathy during their lifetime. Many a times, most of these patients will be completely asymptomatic during the early years of development of nephropathy. And the end result of that is kidney failure and dialysis. If we really need to prevent that from happening, there are plenty of fantastic screening tests, not plenty of nowadays, plenty of fantastic drugs, but screening tests which include simple urine tests that need to be kind of tested. The patients have to understand that this is important, that they need to attend the OPD and do the tests recommended by the doctor, so that early recognition of this protein leak by sensitive tests can then be treated appropriately with wonderful drugs which nowadays are available to prevent the progression to end-stage renal disease and dialysis. And retinopathy, again, it's a very silent disease, like how you were alluding to. It's a silent killer. Nearly 20 to 30% of patients develop retinopathy over the time, multifactorial, including influenced by genes, but many patients would not know. When we counsel or talk to patients about screening for retinopathy, minimum at the time of diagnosis and every first after 5 years and then annually, they always talk about visual acuity. Yes, doctor, we've recently gone to an eye test. They've checked my vision. Everything is okay. So it's important that they understand that this is not just routine eye test, but the eye test that involves putting drops, dilating the pupils, looking at the back of the eye to pick up early signs, because that's nearly 20% of sudden visual loss across the globe in the age of 50 plus in diabetic patients. 1/5 of them develop sudden visual loss. So it's important that they get screened with right investigation, right tests by either an ophthalmologist or in the diabetic clinic itself by a doctor if they have the appropriate equipment, and then take precautions to avoid that visual loss. So all these complications that you mentioned are very important, that a lot of them don't actually have any symptoms that they can notice until the end stage, where the treatments can be hard and sometimes irreversible. So it's really, really important that they follow doctor's advice, get themselves screened, and use appropriate medication to minimize the risk of these complications.
Thank you. So now we travel a little northwards from your place. We come to the city of Charminar, Dr. L. Reddy. So, once diagnosed with diabetes, what daily habits and routine checkups are most crucial to prevent long-term complications? Because we keep on hearing about India becoming the diabetes capital of the world. So I think some take-home messages should be there for the public at large, that
Yes.
what are the daily habits they should inculcate, what routine checks they should do to prevent long-term complications.
First of all, I'm thanking you, sir, for involving me in this panel discussion. For any diabetes patients who is recently diagnosed, we have to counsel regarding a proper healthy lifestyle and importance of taking medication regularly. We have to advise the patient to follow regular healthy lifestyle, like proper balanced diet, which is rich in carbohydrate, whole grains, which are consisting of complex carbohydrates with vegetables and fruits, along with the low trans fat. We have to advise them to take a minimal amount of refined carbs. Better to avoid any high sugar contained beverages. So moderation of alcohol intake is helpful, and in addition, smoking cessation is important because smoking aggravates the complications of diabetes. So, proper physical activity is also important. Have to advise the patient to exercise regularly, at least 30 minutes per day, 150 minutes per week, which includes walking, swimming, or cycling. So, in addition, the patient has to follow a regular healthy lifestyle, proper sleep habits. Adequate sleep is also important to reduce the complications, and just to minimize their stress by means of peaceful yoga or mindfulness. So when it comes to the routine screening, the patient has to check their blood sugar at regular intervals as advised by the healthcare provider, and his HbA1c should be checked at least 3 to 6 months. Then he has to maintain his blood sugars at optimal level, and it has to maintain blood pressure as well as cholesterol level to minimize the cardiovascular as well as stroke risk.
Thank you. Welcome, Dr. Nitika. In fact, I was introducing the others on the panel before you joined
Yeah.
in.
Good evening, sir. Yes.
Director of
Why-
Ops and Gynecology at Fortis Memorial Research Institute, Gurugram. And people wondering what is the obstetrician doing amidst the diabetologist or endocrinologist. As I was just mentioning that she has a very important role to play, very important messaging she can give. So,
Yes, sir.
starting off with the first question that I wanted to ask you is that will be useful for the general public and especially the would-be mothers, is that what early signs should pregnant women watch for that may indicate gestational diabetes before the
Yes.
routine screening tests?
So actually, I would just like to change this one line. Every woman needs to be screened. We don't have to watch for any sign, but as they are getting pregnant, most of them come to us for preconceptional counseling. If they have a high BMI, if they are elderly, if they are having PCOS, anyways, their chances increase by 3 times. If a mother is walking at the age of 25, her chances is about 5 to 10. If she comes to us at 30, it anyways increases till about 15. And if she comes between 37 and 40, we're in Gurgaon, I'm facing that my 50% of OPD is above 37. The chances go very, very high, up to about 30%. Since morning, sir, today only I'll tell you, I have seen 3 mothers who are on insulin, and I have seen at least 4 high GCT values. So we have to do a screening, sir. So they're the symptoms of frequent thirst, fatigue. These are very generalized in pregnancy also. We can't limit our screening to these symptoms. Even lean women, they also are extremely prone to develop diabetes because we know in India we are actually the diabetic capital of the world. Now they have told that we are also the gestational diabetic capital of the world. All over world, the incidence is 1 in 10. But in India, the gestational diabetes incidence is 1 in 5. So we are really, because we are more prone to develop diabetes. We have
So
more of
just,
body fat.
sorry to interrupt, ma'am. Just
Yeah.
for the general public, if you would just elaborate, what are
Yeah.
the screening tests they should do?
See, the screening test is that first and foremost when she comes to us, no, definitely on the first visit itself, at least if we do 1 3 months test, which is HbA1c, that is very important. And at 12 weeks and 26 weeks, we anyways have to do a detailed testing. At 12 weeks, also we have a special criteria test, which is known as the DIPSI test. That is in which we give them a measured amount of glucose, which is around 75 gram, and then we do a 3 sample test or a single sample test depending upon what are the high risk factors she is carrying. Like I told you, age, BMI, history of PCOS. Moreover, what was her condition in the last pregnancy? Fifth, what is the family history? Does she have a parent or a grandparent also diabetic, which generally comes yes. So in these cases, we definitely do a check at first visit, then 12 weeks, and a detailed testing with glucose at 26 to 28 weeks. So this is definite without any symptom. She has to undergo this screening test.
Thank you. Uh, Dr. Vishwas, now coming to use that, how can individuals make their everyday meals healthier to prevent diabetes? Because food is a very important part of the Indian culture. Okay? And without having to give up the foods that they enjoy. So what is your take-home message that you want to give to public at large, that what they should eat so that which are the foods that help them prevent diabetes?
So, for this, it is very important to know that moderation is the key when it comes to managing diabetes or even preventing diabetes with diet. So, as it has already been spoken about, the use of complex carbohydrates, avoid or curtail sugar sweetened beverages which are commonly found in the market, more of green vegetables, fruits, and proteins in the diet, avoid high unsaturated fatty food, avoid junk food, limit your alcohol intake, and to completely stop smoking. So these are the dietary habits which should be incorporated to prevent diabetes, especially if you have a family history of diabetes, if you are overweight or obese, you have a history of PCOS, then there are chances that you have a higher risk of developing diabetes. Apart from that, exercise is a must, as has already been mentioned, minimum 30 minutes per day. In fact, in younger patients, the guidelines do recommend 1 hour per day. So that is very important, and resistance training 2 to 3 times a week.
Okay, thank you. Dr. Srinivas, you are in the Silicon Valley of India, and there's a huge young population there, active, brilliant. But so, what is the message that you would like to give? That we see more young adults developing diabetes, and what is driving this increase, and what early warning signs they should pay attention to, because it's very apt for we call it the demographic dividend. I think so that's something that we need to take care of. And what is the message in general?
So I think we've already, I mean, the broad foundation about, importance of complex carbs, minimizing high sugary drinks, and exercise has been laid by my previous speakers. But you're right. I mean, this is a typical milieu creating good for diabetes in young, the corporate jobs that IT capital offers, where people are relatively prosperous at young age, no exercise, plenty of food available. If they do have strong family history, that they if they're obese, which is what is one of the common risk factors, they tend to develop diabetes very, very early on, unfortunately. And so the practical advice is always to pay attention to this conundrum. For example, if you are like what they've already mentioned, if you are obese or prone for obesity, if you have family history, then it's really, really important that you pay attention to your health, and you spare time and recognize the importance of this metabolic disease, which is basically diabetes and related complications that include weight-related complications and diabetes-related complications, and try and take things seriously about work-life balance and improve on focus on the health issues that my previous speakers have spoken about, and pay attention. One of the things that practically I advise for many children, many of them become diabetic, or sometimes they come to attention, or sometimes they bring their parents to see me or to see the doctor in the hospital. So I always tell them, if your parents are diabetic, I take that opportunity, if they're obese, or even in GDM patients who may later on develop, try and explain to them the importance of changing the kitchen habits in general. For example, make kitchen habits favorable to healthy food and healthy eating. For example, try to cook interesting. Your previous questions, such as how do we make food tasty despite having diabetes? Say, for example, try and make it a habit to create and cook good salads at home, which are low carb and healthy and tasty. Try and avoid ordering foods from outside, as a kitchen habit, as a cultural habit within the family framework, so that children, which in fact later on become childhood obesity, which is a big problem, which is creeping up to become plumpy kids with increasing prosperity and sedentary lifestyles, is broken very, very early on. One of the problems is they get into the habit of eating healthy, unhealthy foods such as pizzas, pastas, and high carb diets. And then when you tell them, look, you need to stop doing all that, it's a big, big blow, and they feel as if they're deprived. So one of the things one can do as young adults, and seeing their parents, or if they are prone for it, is to change the cultural habits in the kitchen that can also percolate down to children, so that we minimize this risk in the generations. But yeah, it's a very, very common problem. Yeah.
Thank you. Now I come to Punjab, the Puttar, Dr. Vijay, because Punjab also has a very high incidence of diabetes. So, and a lot of times it runs in the families also. So if it runs in the family, what are the early signs that one should be looking at, and which tests are the most important?
Very pertinent questions, sir. Regarding the signs, obviously the signs, osmotic symptoms, that is polyphagia, polydipsia, and the polyuria. And along with that, now we call it 4 T's. It is toilet, increase urination. Second T, increase thirst. Third T is thinness, which has been added because in most of our type 1 diabetes patients, it is they get very weak. And fourth one is the tiredness. If they get very weak, lethargic as well. So this is the classical spectrum of the type 1 diabetes mellitus kids. They should be these symptoms should be taken very carefully. Along with that, we have another subset, as sir was discussing, the adolescent diabetes and the youth onset diabetes, plumpy kids. So if the child develops obesity, or there are evident sign of insulin resistance. Insulin resistance means there is acanthosis nigricans, increased pigmentation around the nape of the neck or the flexular areas in the armpits, at the elbows. If the hyperpigmentation is there, and along with the skin tags, that is acrocordons, if these are present, these are the signs of insulin resistance. So in such kids, they should be taken very carefully, and early screening is required along with the classical symptoms. And your second question was, I'm sorry.
Then what are the tests which are most useful?
Yes. So, as I said, that the kids who are presenting to us with the osmotic symptom, classical osmotic symptoms of polyphagia, polydipsia, in those kids, I would like to do the glucose random or the fasting PP, because in such a cases, the onset and the progression of the diabetes is very, very rapid. So, it might be that the HbA1c is not that much deranged, and we may misdiagnose them. So, in those cases, definitely the glucose random along with the ppgs along with the hba1c. But those with those plumpy kids, those with the insulin resistance, hba1c, that the 3-month glucose values, they are very, very important.
Thank you. Uh, Coming to Dr. LRD, is that why do some people continue to have uncontrolled sugar levels even after starting treatment? And what should they do differently to manage the diabetes better? Because this is a sometimes you get this problem that they've started treatment but sugar levels are not being controlled. What should they do? So they keep going from helter skelter to start looking at options to say that how they control the sugars.
Thank you, sir. In significant proportion of patients, they tend to fail to achieve the good glycemic control. As various studies suggest that only 20% of patients achieve the target HbA1c, that is less than 7%. There are several factors which are responsible for this non-glycemic control, which include most of the times dietary as well as medication non-compliance or non-adherence, which is plays a crucial role. Most of the times, patient tend to skip the dose of either insulin or oral medication. So if the patient without some most of the times they tend to take high carbohydrate diets in between and fail to comply with exercise routine. So sometimes the patient on medications such as steroids, which may also play an important role in worsening of the glycemic control. So for those patients, we have to advise that adhering to strict daily routine along with physical activity and exercise, which helps to achieve the good glycemic control. So most of the times, patients tend to have multiple oral antidiabetic agents, like more than 3 oral antidiabetic agents. In spite of that, they tend to have higher blood glucose levels with HbA1c more than 10%. Still, they are reluctant to start insulin. So, in such of patients, adding insulin definitely helps. So, we have to counsel the patient properly. So, with the initiation of insulin, we can achieve better glycemic control. Earlier insulin therapy is required in long-standing uncontrolled diabetes patients who are on multiple oral antidiabetic agents. So proper sleep is also required. So we have to educate the patient regarding importance of sleep, reduction of stress as well. So while taking a medication, they have to check the dosage of medication regularly. They have to follow the physician for the proper management.
Thank you.
Dr. Panigrahi, I have a small thing to add. Is it okay if I go ahead? So
Yeah,
just taking the cues from Dr. Reddy's discussion, in my kind of clinical experience, I find patients sometimes when we give the prescription, they assume that their sugar controls will come down right away. And sometimes they actually do face problems taking pills in terms of side effects or sugars not coming down at their own according to their own expectations, or sometimes sugar levels dropping too low. And many times, instead of reapproaching the doctor, explaining the problem and taking advice, they just fall off the radar. So they should not do that. They should understand that sometimes every person's body's response to a particular drug and the dosage is different. And it's important that they follow doctor's advice. If they do face problems with either not being sugars not being controlled, or sugars dropping down too low, or experience any side effects, they have to go back to their doctors, re-engage, and tell them, look, doc, you've given the treatment, but this is where I am. We can always remodify. But many times they fall off the radar, particularly more importantly on insulin. When we start insulin on a small dose, they start, and once they see sugars are not coming down, they say insulin is not working in me, which is actually not true. Apart from all the correctable factors that Dr. Reddy alluded to in terms of good diet, exercise, compliance, and all that, sometimes they don't understand that one dose is not the fixed dose for everyone. They have to re-engage with the doctors. So I always insist you should come back and tell us what your problems are so that we can, instead of going parallel.
Dr. Nitika, your specialty plays a very important role.
Yes, sir.
You take care of two, the mother and the
Yes,
baby.
sir. And it's a lot of impact.
So what I'm asking is that how does uncontrolled diabetes affect the health of both mother and baby during pregnancy? Because it's a very important message that
It's a
we
very important thing, sir. First and foremost is that immediately, if we just talk about the baby's growth is increased. In fact, in the first 3 months, that is why even the mandate doesn't tell us that we should definitely do an HbA1c when the patient first comes to us. But nowadays, we've started doing it because that HbA1c, the 3 month sugar in the periconceptional period, plays a very, very important role in the development of the baby. So we have to be very, very clear, and we do very, very early scans because recently, like I had a patient who had a HbA1c of 7.9. Though her fasting and PP sugar when I did it was just 96 and 126. It's not much if we see by our parameters of normalcy, but her HbA1c was high. So we did her all early scans, we did everything, and we finally did take into that account that we'll be very sure around the 22nd week because the cardiac development of the baby is very, very engaging. It's very important for the HbA1c levels, our sugar levels, to be good. Though these are things which we find every time when the patient is not coming to us preconceptionally. But definitely, if we detect it later, which is gestational diabetes, we will only start once we have that the patient is over 20 weeks and we are doing a GCT test, which is a mandate. It has to be done around 26 weeks and we find the high sugar. If we don't control it at that point of time, macrosomia, big baby, more of LICA, which is not going to let the baby settle, there is more risk of cord prolapse. There is more chance of our baby going into low sugars once the baby is born. Another important factor is now the studies and the epigenetic mechanisms have made sure that if your mother is uncontrolled diabetic, chances of the baby developing childhood obesity and diabetes in adulthood is very high. So it just doesn't limit up to the time when we deliver. It also goes a long way. And on the mother also. One, she's a potential diabetic, meaning she in her 40s, early 50s, probability of her developing diabetes is very high. Second, risk of getting diabetes in the next pregnancy increases by over 20%. Meaning one pregnancy, she is diabetic. If she takes care of her lifestyle, she cuts down on her fat, body fat, visceral fat, increases muscle mass, there's a chance she doesn't, but she will go. Another important part is more chance of cesarean sections. So more chance of developing hypertension. They generally go hand in hand. So we have seen an influx of diabetes, sir, in the last 10 years. I mean, at least in urban cities, it's like we feel, oh, her sugar is normal. That is the kind of scenario that we are facing in metros, at least in our hospital, because we're all dealing with mothers but they're aligning also. The good part is they're understanding. They're very careful during this time. They are willing to do anything and everything. And I have seen in my practice, at least, more than 70% of them are resolving on diet and exercise. And post-meal walk of 15 minutes, sir, is the key. No patient will do it so diligently as a pregnant woman. And the effect is phenomenal of that post-meal walk. I mean, even if she's eating, maybe I would say 2 spoons of something, the sugar will go off. And she has taken a walk. She says, ma'am, my sugar post-meal is 98. That is the difference. So these lifestyle measures are very important, but it does impact the mother and baby both.
Thank you. Coming to Dr. Anupam, how much does stress, long working hours, poor sleep contribute to diabetes in our
Lots,
normal?
lots.
So this is a common problem what we face across, especially in the metros, the corporate life, where there are long working hours, poor sleep, increased stress. They all increase the stress hormone cortisol, which once it is increased, there is decreased responsiveness to insulin, what we know as insulin sensitivity. Apart from that, hormonal changes can also disrupt the gut. So there have been studies which have shown that poor sleep can also increase the hunger hormone, which is ghrelin, and also decrease leptin, which is the satiety hormone. Apart from that, one more very important thing to remember for patients with diabetes, some of them may be having obstructive sleep apnea. That is very important to screen these patients who are obese and diabetic, to rule out sleep apnea in these patients, because they do wonderful with certain weight loss drugs and CPAP machines, which give them adequate sleep and make them active for the next day's work. So, sleep, stress, and long working hours are also predisposing patients to diabetes, and we have to take care about these factors, prioritizing sleep, sleeping for almost 7 to 8 hours a day, less stress in work. You can add yoga, meditation in your daily lifestyle, daily exercise, and make sure you monitor your blood glucose daily.
Thank you. Dr. Srinivas, I'll come to you now. Is that you mentioned that in your introduction, when you mentioned that when Dr. Larity was mentioning, it's very important for someone recently diagnosed. What are the most important steps they should take in the first month to stay in control? You mentioned it, but if you could just sort of elaborate in more detail for the public
No,
at
I think,
large.
yeah, another important, very important thing is most type 2 diabetic patients, which is what we are alluding to, respond, particularly young people, respond very well to diet and exercise. I'm sure all of us must have been familiar with patients talking about diabetes cure or remission, what we call remission, but diabetes cure. So there's a very big chances of them going into remission or curing themselves, in their terms, stopping medication, if they actually take right precautions, which is focus on right diet and exercise. And many a times I motivate them, even if I start them with 1 or 2 pills, sometimes even insulin, within a month or two, if they actually work hard, if the genes support a little bit the element of glucotoxicity. So when the sugars are very high, their pancreas artificially become even less functional than what they are capable of. Once we take that away, once we push them into good lifestyle and diet and exercise, many a times, a lot of these patients can completely stop the medication and achieve remission. So it's very important that they should not, and more importantly, they should not fall off the radar, they should not ignore. Two, there's this concept called legacy effect, which means what happens in the first 1 year to 5 years of diabetes actually affects their 10-year, 15-year, 30-year outcomes. In fact, what we see ironically in patients is when they come for the first time attention with symptoms, you give them some treatment, they feel better, and they fall off the radar. They ignore the disease for a while, and then they catch up, which I think is the wrong way to approach it. So it's important to make them understand and realize that it's important that they understand and realize that the first few years are the golden years of managing diabetes. And in fact, in many young corporate people with obesity and other lifestyle complications that we see, they revert back to normalcy if they actually pay enough focus attention. And first 5 years, good control, golden years, very good outcomes in long term. I keep telling this example of these financial investments, pension funds, mutual funds, short term troublesome, but if you're consistent in the first few years, in long term, your wealth grows or compounds enormously. Similarly, diabetes, the first 5 years is very important. Even if they are feeling better, it's important that they follow doctor's advice and aim for good diabetes control.
So thank you. I'll just, before I end the session, I'll ask each one of you all to just give one line. What is the message you want to give to the public at large? So, you can start. Anupam, you can start, and then we can.
So, most important is early glucose control. That is should be the goal. UKPD has recently given a 44-year data, long-term data about early glucose control, which is the most important thing when it comes to preventing complications of diabetes.
Ready?
Proper lifestyle is important in managing the whether it is type 1 or type 2 diabetes. So, but as already sir discussed, after achieving the remission, most of the patient tend to lose the follow-up. And they tend to present after 1 year or so with elevated blood sugar levels. So, follow-up is mandatory for everyone.
Thank you. Dr. Vijay?
I would like to tell my patients and the general public that please don't fall into the trap of misinformation on the social media. Please listen to your endocrinologist or the diabetes care provider for the rightful information. Diabetes reversal is not an appropriate term, it is the diabetes remission. So please take the help of your endocrinologist.
Thank you. Dr. Srinivas?
Engage. My sincere advice: engage with, make doctor your friend. Diabetes is not a problem if you actually make doctors your friends and follow up with them. They are here to guide you. Don't feel, I tell my patients, don't feel punished. We are here to help you. We'll try and make the journey as smooth as possible, but please engage. Don't fall off the radar.
Thank you. Dr. Nitika?
So I would just say, please, please, please use the time when you are planning a pregnancy. Make sure that before you have a puberty positive, make sure about your weight and your levels. You still have that golden window period to take charge, because that's going to impact your destiny and your child's destiny both. Because you are now instrument to create two lives. So you can just give 3 months time period trial, make sure that is all fine, and then move ahead. You will not even develop it during those 9 months, and your baby will also not develop it.
And I must thank all of you all. I think so, for the public at large who are seeing this and listening to this, I think so it must be thinking that why Fortis Healthcare has taken this initiative of Facebook Live, because diabetes is growing by leaps and bounds. We are now got the name of the diabetes capital of the world.
Yes, sir.
So Fortis Healthcare as a network, we want to see that we are properly equipped. And the worrisome part is that the demographic dividend that we keep talking about, that's a nice lingo that we keep hearing. That is the economic powerhouse that will take us to the Viksit Bharat going forward. So I think so keeping them healthy is very important for us. And I think so diabetes is a very important part of that journey. So Fortis Healthcare has put a lot of effort on this. And the message, something that came out from this discussions was again, is that I think so the kitchen table is very important. At least one meal should be there cooked in your kitchen, and the family should eat together. A family that eats together stays together. A family with that eats one meal a day made in their own kitchen, diabetes stays out of the house. So I think these are important messages that came out. And exercise, obviously, it's a common thread. Smoking is something that is a no-no. And as Dr. Shini was rightly mentioned, I think so stick with your doctor, and don't start going from become a Dr. Google and start looking at that and going from one doctor to the other. Have patience. It will pay in the long run. So with that, I'd like to thank all our panelists. Thank you very much.
Thank you, sir. Thank you.
Bye-bye, sir. Bye-bye.
Bye-bye.